and rotate it back. Even celiac disease, when I was a student, celiac disease, like once you have it, always have it. Now we can actually reverse celiac disease within 16 months, not only on the blood test, but by biopsy. So this is fantastic. We didn't have this information of how to restore GI function, but now we do. Symptoms of heartburn, stomachache, bloating, gas, diarrhea, constipation, colon cramps. Conventional doctors, here's an acid blocker, here's a stool stopper, here's a stool goer, here's a laxative. That's the way they approach it, right? And sometimes they can order H. pylori, and sometimes they'll do an endoscopy or a colonoscopy. On the flip side, since the naturopaths, chiropractors, and health coaches can't prescribe or can't really order some of these tests, then they just treat you naturally symptomatically. Well, here's enzymes, here's clay, here's charcoal, here's probiotics, here's fiber supplements. Now, is that really needed? Is that actually targeted? No. So they're just as I would say, negligent in a way, because the doctors are treating symptoms inappropriately, not underlying looking for what the problem is. But then the naturopaths are just throwing everything out at that sounds like it could be helpful, but they're not really having any guidance. And then most of these people might be offering programs like cleanses and detoxes without even knowing. How do you know you need a detox? How do you know you're not detoxing correctly? We will talk about that in a second of how to notice that and not just randomly taking products that actually be causing more dysfunction than not. Conventional doctors can recommend endoscopy, colonoscopies, and then treat symptoms. So I'm all for testing. I mentioned it before. But say if someone has small intestinal bacterial overgrowth, most doctors don't even know how to treat that. Or if they use antibiotics, they don't know which antibiotic, for example, because they want to just use common ones. There's certain what they call eubiotics. There's certain medications that go specifically for small intestine. Unfortunately, they can be expensive. So we have to look at ways how patients can actually obtain drugs. Like in other countries, these drugs are only $150 to $300. In the United States, it's $2,500 sometimes, unfortunately. Right? MDs don't know how to test about microbiome in general. Now, a lot of them are like on these panels are learning or they're already into it, like we are. But a lot of them just don't know how to treat increased intestinal permeability or leaky gut. Now, on the flip side, you'll see that a lot of the natural people, health coaches and chiropractors, naturopaths, provide natural antibiotics. Well, let's just treat the symptom, again, with a natural thing, but not understanding, well, what am I treating? They can't prescribe meds sometimes, which are actually better. And on both sides of the aisle, they're failing because they're recommending diets that are negative and harmful to the microbiome. So anybody tells you to eat paleo, keto, or low carb, and now more importantly, FODMAPs on both sides of the aisle, we now have data showing, and I was actually last week speaking to a company that's actually evaluating, they were looking at 30,000 microbiome studies and tests which they have in their database. And they actually can subsection, because they do a questionnaire, looking at people who were on FODMAPs diets and low carb and keto diets, right? Because this is a common thing. And they're taking the history of looking at what is that history of the diet compared to what's actually growing in their gut. And FODMAPs and paleo and keto diets are actually suppressing the most important microbiome, these probiotics, these healthy species in the gut. And so a lot of people who push these diets, not understanding, it's just like taking a drug like an Ozempic. Like we're treating a symptom, but we're not actually fixing the physiology. We're actually harming the physiology, anatomy, immunology, and it's actually causing more problems. And then people cannot eat those foods, so then they have to stay on a restricted diet. But you should be able to eat the most healthiest foods that keep people the healthiest longest, and that's a plant-based diet. Now, test number 2, part of it, we want to look at pancreatic enzyme function, okay? So a lot of people say, gosh, your conventional doctor is saying you have an acid problem, so they're giving you an acid blocker. And the naturopath and the holistic people are going to be saying, hey, you actually need more acid, and they'll give you something called betaine hydrochloric acid. I don't recommend that at all, because most of the patients actually have gastritis. So when we take hydrochloric acid, that actually can increase their risk of having more gastritis and risk of ulcer. And I've seen that happen. We usually have 2 or 3 cases a year where people actually induce an ulcer by taking acid. Okay, it does help with the digestion. So we want to test, is their pancreatic enzymes good or not? If it's good, you don't need to have anything, not even natural supplements, not even an acid blocker, right? Because we want to look at what's triggering the inflammation from the foods. Eating plant-based, test the food sensitivities. You don't need to have an acid blocker, right? But if you do have an issue and your enzymes, say, for example, are low, then taking enzymes are safer and more effective at breaking down the foods than just getting hydrochloric acid. Right? And we can do that safely and effectively rather than causing more risk of GI issues. All right. So we have digestive enzymes, but then we even have chewable digestive enzymes, because some people have low enough enzymes, they can't even break down a capsule. The important thing is that if someone has low enzymes, then all their medications, and this is where it's really important, because as we get older, we do, in certain patients, in certain populations and risk factors, can have lower enzyme function, but then they're not able to break down their medications or supplements or their foods. So their nutrients go down, And over time, they say, oh, well, my blood pressure drugs are going up and my thyroid medications are going up and I need to take more and more and more. But physiologically, they haven't changed much. They haven't changed much in their diet. But what it is, their blender function is not working as well. So this is what we have to evaluate rather than just throwing things at the patient. We have to look at, is that a problem or not? Second part of the test is test number 2 is if they're having stomach pains, diarrhea, constipation, weight loss, or low nutrition levels, then we got to look for inflammation. We can actually see the eosinophils. This is like the border patrol of your gut. These are the soldier cells that are lining your GI tract. And if there's inflammation there, remember, not everybody's going to see anything on a colonoscopy. You have to have really bad inflammation to get a colonoscopy to say that you have, colitis, right? But we're talking about the microscopic function. Is there just a border problem? Is there a leaky gut? Is the fecal secretory IgA elevated? Is there inflammation in the gut where now certain foods and certain particles are now leaking, entering in the small micropores between the tight junctions between each cell of the GI tract, triggering an inflammatory response? And if people have this problem, they will have more food sensitivities. And we can now reverse the food sensitivities, rotate the foods back, and fix the gut completely. We didn't have this information and technology of testing years ago. We kind of treat symptomatically, and some of it was good. Some people got better, but some people didn't. And now we have the answer, and we actually can give the right appropriate products that can actually fix this. We can actually reverse this leaky gut. And the idea is not just taking a product randomly, is that we have studies now to show that we can actually improve that cellular function, lower the inflammation correctly, but also we can retest and then demonstrate the efficacy. Not only does the symptoms of the patient get better, but actually improve the physical function. If someone has bloating, belching, excessive gas, we need to check whether they have what they call SIBO, which is small intestinal bacterial overgrowth. There's 3 types of that: hydrogen, methane, and hydrogen sulfide. But the interesting thing is, each of these overgrowths in our small intestine, which causes bloating. So a lot of people wake up in the morning, my stomach's pretty flat, doctor, but then by the end of the day, I feel like I'm pregnant or Santa Claus, or I got to unbuckle my belt or my pants or my skirt. I just feel like my belly's really bloated. I sometimes have excess belching, or I just don't want to eat too much because I'm so bloated by the end of the day, regardless of my diet, regardless of what I'm eating. Then we got to test for it. It's a breath test. But the key is, here's the challenge with a doctor or the natural therapies, is that some of these work better. Drugs work better with certain types. Natural antimicrobials work for certain types. And depending on whether the patient's having loose bowel movements or constipation symptoms, even those drugs or natural therapies also differ. So you really have to understand the dynamics of the patient's GI symptoms, their health, their diet, and the therapy, the pharmacology, to make a decision. The problem is right now, doctors will be like, here's the antibiotics we give, and the natural products of the natural people will be like, here's the natural supplement to take, without actually having that fine tuning. And this is what we like to do, because anytime you give a natural or prescription anti-anything, you still are causing dysfunction to the microbiome. So we need to be really cautious and really specific when we give therapies that we're trying to target as much as possible and have the least amount of collateral damage. We want to check the absorption, proteins, fats, and fibers. So when someone's having diarrhea, constipation, IBS symptoms, maybe they're losing weight, maybe they're gaining weight, maybe they're tired all the time. I think I'm eating right, Dr. Pai. I'm eating a plant-based diet or plant-forward diet or Mediterranean diet or a clean diet. Well, let's just check. How much protein are they breaking down? We can measure the levels of protein, and we can say maybe people are not eating too much protein. The challenge that we have with plant-based diets is that when people took out the main that they were eating, which was an animal protein, right? Beef, pork, chicken, fish, dairy, and stuff like that, and they had a side of vegetables, grain, legumes, and seeds and nuts, they just weren't really trained on how to really fill the rest of the plate. So a lot of problems that people have when they first move plant-based is that they're not eating enough. For a female, 50 to 60 grams protein. For a male, maybe 60, 65, 70, if that. It's all you need of plant-based protein. But the average American is having 100, 120 grams a day of animal protein, causing kidney, liver, cardiovascular, cancer risks, everything, as we talked about and you can read about. What about fat? Some people are not eating enough fat. Now, there's the crowd of people that are eating. I have people come in who are keto. They're way over here. They're eating so much fat, and it's terrible. Pro-inflammatory, saturated fat, suppressing the microbiome, all sorts of problems, right? Their cardiovascular risk off the chart. Their inflammatory risk off the chart. They feel good. I'm drinking MCT oil and all stuff. The cholesterol is 350 or 400 off the chart. But we also have the flip side. We have people like no fat, no sugar, no oil, and they're really, really low. They can feel tired. Their cognitive function. So there's a delicate balance. We want to have some avocados. We want to have some nut butters. We want to have some of these healthy fats. Now, Too much olive oil is a problem. People are just taking too much excess fried foods. That's a problem as well. So we always have to find this delicate balance. Looking at the amount of fiber, super important. We need, as I mentioned before, we need to be having about 30 grams, 35 grams or more of fiber a day to create our microbiome. This is short chain fatty acids. This feeds your N-butyrate. N-butyrate is the energy molecules in your gut that make your microbiome survive, and that gives them their energy. But people who are on paleo or keto diets, they're down here. They're not producing any because they're not eating any fiber, right? People on FODMAPs diet over here, they never get better. That affects their immune system. 80% immune system is in your gut. So you have to look at how to fix these things and how to also, if they have an imbalance, how to slowly bring back 5 grams per week, additional fiber to eventually get to that. And we help our patients. They'll have food sensitivities. They might have some inflammation in the gut. They might have some toxicities. We have to work on it level by level. And it's a strategy, not throwing everything at one time. And you have to understand the building of systems. And that's what we do. But we can educationally measure. I had a patient the other day who was trying to go plant-based as much as she can. She said, "Oh my God, I'm eating so much fiber, Dr. Pai. I feel better. I'm having bowel movements, but I'm having, I'm tons of fiber." So I go, "Well, how much are you taking?" She pulls out an app. She's actually tracking. I didn't know that she had that. And she's like, "Oh yeah, I'm having a lot. I'm having 13." And I started laughing. I'm like, "Yeah, the average American's having 7 to 13. That means she was eating less before that, right? And we want to get to 35 or 30 or more, right?" So it's a slow process, but we have to learn how to incorporate more of the plant foods because only plant foods have fiber. Now, if people have SIBO, they have small intestinal bacterial overgrowth, and they're being treated over and over and over. They go to these programs. "Oh, I'm on my 3rd or 4th, 5th treatment. I've had this for 2 years. I keep on going every 3 months to this doctor and giving it." Then we have to look at, do they have biofilms? Do they have biofilms? It's a protein coat that in the microbiome, it can then cover itself, and then the treatment's only treating what's outside. So they get a temporary benefit of the drug or the natural therapy, but then after a couple of weeks of treatment, it comes back. So we now look at, there's certain what they call biofilm disruptors that we can provide that easily can make the success of treatment more successful, right? Because we want to bring those imbalances back as fast as possible so the patient then can eat more of those foods so they don't feel bloated. And once you start eating more of those foods, it actually prevents them from getting the problem to begin with, right? So it's reestablishing the balance to the imbalanced microbiome. When we look at constipation, diarrhea, colon cramps, gas, again, low nutrients, weight issues, then we also want to look at, is there any kind of imbalance or overgrowth, right, in the microbiome? So the difference is that when we look at testing, there's some companies that will test and say, "Okay, you have too much of this and too much of that." And there's a lot of companies that do that, okay? And they're not wrong. They're just saying you have a lot of this. There's an overgrowth. But we want to go one step further, because if there's a bacterial overgrowth in the gut, and they'll tell us whether these are not panels per se, they're actually individually identified. So a patient may come back with one thing, they might come back with 10 things, they may come back with nothing. So it's not just a standard screening panel. It's like they look, microbiome, the microbiologist will grow it out in culture, it takes 3 weeks, and then they will identify which species are normal in the microbiome and which one is an overgrowth, is too much. But if it's an overgrowth of, say, bacteria or mycology, which is Candida yeast fungi, they'll identify the species and they'll let you know how much. Now, a lot of tests can do this, but we want to go one step further. We want to look at what's the sensitivity and what's the resistance, meaning if we use a drug like amoxicillin in this case here, which I wouldn't use, I'd use more of the natural therapies, but would it work or not, right? Is it sensitive? If we have a fungal infection, overgrowth, for example, these are overgrowth, sorry, not infections, does it respond to the drug, or which natural antifungal? The problem is a lot of people just get a test that something's elevated, and the naturopath or the health coach or the chiropractor, or even sometimes the MD will be like, "Here's an antimicrobial." The problem is, again, some antimicrobials are just for bacteria. Some antimicrobials are antifungal. It's like giving you the wrong medication for the wrong problem. So it's just like an example would be like, "Oh, I got a viral infection and my doctor gives me an antibiotic," right? It's not going to treat that because they're two different type of problems, right? And this is what happens in the natural too. A lot of people are like, "Oh, I think I have candida. I got to do a candida cleanse." They take these natural anti-candida products. If they don't have an overgrowth of their gut of any kind of fungal or mycology organism, then they're actually causing more dysfunction and harm. So I've tons of patients that come to see me who've done cleanses and programs and detoxes, and in fact, their microbiome is worse. Their symptoms get worse. They think that they're not getting rid of the program, so they double down. "Oh, I'm going another round. I'm going another round." But you have to be treating these things specifically. You have to have targeted effects. You have to have good intel before before you go invade, because there's always going to be collateral damage. And the problem is right now, it's just like an all-out war. People are like, well, let's just throw, the drugs, or let's throw the natural things without knowing even what's resistant. Since pandemic, we've seen this huge change and shift in microbiome resistance. Why? Because a lot of us, natural people, we're taking things for getting our immune system strong or for infections. And so we're now seeing the things that were really, really like go-tos, are some of our favorites now that were 60, 80, 90% effective in culture, now that are dropping 50%, 40%, 20% because of resistance. More and more people are taking natural therapies indiscriminately, too long, for months and months and months, doing these programs, not understanding like that's an antibiotic naturally. You wouldn't take amoxicillin for 6 months. So why would you take a natural amoxicillin for 6 months, right? But this is where you have to have that guidance, and we can help that guidance for you. The third test I want to cover is looking for nutrition. And this is super important, because if someone comes in with fatigue, any kind of inflammatory conditions, blood sugar problems, cardiovascular problems, metabolic problems, if they have cancer, or just general health, hey, doc, I'm plant-based, or I'm an athlete, or I'm a performer, and I want to perform better. And my trainer says I need to eat more, or my naturopath is giving me tons of supplements, or my lifestyle medicine doctor is saying I need to eat more greens. Yes. All of these things can be very helpful, but why don't we test it? We check the cholesterol, we check the blood sugar, we check the thyroid, we check all these functions, but we don't test the most important thing every day. Food is medicine. But how do we know, are you eating the right foods or enough of the right foods? Each of our microbiome is completely unique. How do we digest, absorb, and assimilate is unique. So if we all eat the same meal, if we were all at this conference and it was plant-based food and we ate the full nutrition, here's how many proteins, carbohydrates, and fats, and it was all balanced, rainbow-colored foods, our testing would be different, because that's how unique we are. And that's why we're now individualizing medicine. So it's not a one size fits all. A lot of people go to the health store. A lot of people go to natural products doctors, and a lot of people go to holistic doctors now. And it's like, here, just take a multi, take this, take a that. And I'm like, why are you taking this or that? Like, do you have it low? Just like, do you have a candida infection? Do you know that you have it or not? Check it. Have it tested. We can look at all your antioxidants, A, C, E, how you're detoxifying, your glutathione, your alpha lipoic levels, your CoQ10 levels. If someone has good CoQ10 levels, they don't need to take these things. And more importantly, your B vitamins. Again, primary doctors are only checking your B12 and folic acid, but what about the rest? B2, B3, B6, B1, magnesium, manganese, zinc, molybdenum, even your fatty acids, your omega-3s. We need to measure these things. Why? Because it's not just saying how much you need to take, which we will tell you. We will then tell you, more importantly, which foods you should be eating more of, because food is medicine at the end of the day. And that's what we teach our patients. Supplements are supplementing the diet, but they're not replacing the diet. A lot of people like to replace it. Like, hey, I just take this, I don't have to eat. No, you got to eat all these foods, because the supplement is only going to give you one angle of that one option of that replacement, but it's not giving you protein. It's not giving you the fiber. It's not giving you some of the phytonutrients. It's just giving you that antioxidant, and you need to be getting it from food. So we then teach the people, even if they have sensitivities, hey, we need to now figure out what other foods that we can bring in, right? So it's a full systematic approach, but it's understanding what you need and how much you need, and then what can you get it naturally. And if you are deficient or you have a specific problem that needs a little bit of a boost, then looking for targeted things that we can provide the right form, the right potency, the right purity is key. But it's also eliminating a lot of things that people come and they have bags, 10, 12 bags of bottles of supplements and 10 or 12 prescription drugs. It's like, and they're not feeling good on both sides. So we have to look at what is right for you and what do you need to eat more of to actually just make food as medicine. We can look at your cellular function. We can look at how your electrons are producing energy. So if you're fatigued and tired, how they all interplay. Just one deficiency has, magnesium, for example, has 300 different reactions in your body. So it's not just like, oh, I just take it for my relaxing at night. It's like, wow, this is affecting how your electron transport chain is working, right? How your cells are functioning. We want to look at like your fatty acids. This is still part of test number 3. A lot of people are like, well, I have inflammatory conditions. I have heart disease. I have elevated lipids and cholesterol. I'm having cognitive problems, memory problems, weight issues. Well, what about your omega-3s, 6s, 7s, 9s, right? Do you convert? There's a big argument that was in the literature and in the industry pushing omega-3s, right? For years, like fish oil, fish oil, fish oil. I have a whole section in my book, by the way, on the problem with fish oil and fish oil companies and the truth in advertising and all that. And I was the first physician to actually formulate a product with a company that now is the gold standard in plant-based sustainable EPA and DHA that's now everywhere in the market, right? This is way back. This is over 10 years ago because we were looking at sustainability issues and toxicity issues. And this is my area of looking at expertise, of looking at herbs and plants in the environment and how then we can take that science and take it to manufacturing and then produce these things. But do you really need an omega-3? I mean, we test the enzyme. And if the person has an impaired function that they can't convert, then yes, I still want them to eat flaxseed, chia seeds, hemp seed, walnuts, but they may not be converting their EPA and DHA, so they can take a plant-based EPA DHA supplement. However, most people that we test don't have that impaired enzyme, unlike what the industry was pushing. And I just say, hey, if your enzyme is functional, now this test shows it's impaired, so this person would benefit, but they were eating some. But oops, let me go back here. If this is functional, then all they need to do is eat more flax, chia, hemp, walnuts, and they get the protein, they get the fiber, they get the EPA, which is for the lipids and reducing their inflammation. They also improve their DHA, which is for their memory and brain function. So the more omega-3s that they have, the more anti-inflammatory they are. The more omega-6s they have, the more pro-inflammatory. So we're always trying to have more omega-3s. Remember that slide. Plants are more omega-3s, although there's some omega-6s in your diet, but we don't want to be eating a high omega-6 diet. And a lot of people who even can be plant-based can have a high omega-6. Why? Because they're eating fried foods all the time, right? So we want to decrease some of those excess vegetable oils that's also too much omega-6. Now, people who want to lose weight, when we look at their omega-9s, for example, this is always high now in patients. There's two patients that we see. So if someone's trying to lose weight, a lot of people just eat way too much oil, olive oil, avocado oil. Now, it's not going to cardiovascularly cause lipids to be elevated, but it's a high fat calorie that people are just over consuming. It's not a superfood, right? Now, can you cook with it? Can you put it with your food? Sure. But most people who come see me who have a weight problem, they're consuming way too much calories indirectly, not knowing that a tablespoon is 210 calories and there's a little bit in the pan 3 times a day. There's a little bit on their bread. There's a little bit in the pastas, a little bit in the food they're putting on their salad, and they're complaining that the carbs is making them gain weight, but it's actually the caloric intake of the excess of fat. Now, on the flip side, we have some patients who are SOS, right? Sugar, oil, salt free, and they're on this side. But then from an Ayurvedic perspective, we can see other problems. So they need to have a little bit of fat in the diet, not a lot, but a little bit. Otherwise, they get drying issues, they get constipation issues, they get terrible dry skin, and they get memory problems. And we can actually measure that. Saturated fat. So we can see whether they're eating saturated fats or not, regardless of the diet. We want to be lower on the saturated fats, right? That's what we're trying to do, reducing cardiovascular disease. And we can also see their just overall cardiovascular risk based on all these ratios and seeing like, is that a factor? Because it's not just, again, cholesterol up, cholesterol down, particle size being bad or not, sticky or not. We're now looking at, can we also balance some of these fatty acids to lower your risk and improve also health parameters? Going further, we want to look at then part of test 3 is we're looking at, well, if you have inflammatory conditions, weight loss, neurological conditions like memory functions, autoimmune issues out of the blue, cancer, and you don't have true risk factors, no family history, no lifestyle problems that could lead to a higher risk, or you just drink tap water. You just kind of like, yeah, I just drink from the sink. I grew up here. I just drink, I don't have a filter in my house. I don't have an expensive thing. Do they have heavy metals, right? So we test part of that is looking at from lead, arsenic, all the way down to uranium. The challenge is that the average person does have toxicity. Now, not as much as you might see on Instagram or social media. There's a lot of people say you got to do cleanses and all. Well, let's test it. But what you want to be careful of on testing is the following. You don't want to be taking a challenge. This is what a lot of natural people in the health world and online programs do is they give you a chelator like an EDTA or a natural EDTA product. It's a binder, it's a chelator. You take it, it's going to excrete heavy metals from your body. You're going to have a certain range of heavy metals in your body. That's normal because we're getting stuff from the soil. The animals are eating stuff from the soil. We're eating plants that are from the soil. So it's not zero. There's going to be a certain range, but there can be a toxicity if it's too much. If someone gives you a challenge before then, you got to run from their office. Why? Because it's a fooling game. You're going to pull out more, then they're going to sell you some kind of detox program or even chelation. Okay. What you want to be looking at is like get the test that is just looking at from your urination right now, how much are you excreting? And if it's above what the normal limits of the government tells you that's high, then it can be a potential toxicity. Now, some of these things can be medical, like, oh yeah, gadolinium. Yeah, I just had an MRI or a contrast scan or any kind of imaging scan that, for my hip, my back, my cancer, my this. So some of it is actually medical, and some of it's actually toxic, like uranium or in this patient here, aluminum, which is off the chart. These are things that are coming from the environment, from food, from packaging, etc.